The Lesotho Defense Force LDF Commander Lieutenant General Kwantle Motso passed his gratitude to the United States government for the meaningful gift meant to better lives of Basotho. He said this is not the first noble initiative that U.S. has rendered to Makwanyane Hospital, as among other things, it has donated 2 vehicles to the hospital.
Despite the countless assistance of different forms I mentioned above, we are today officially opening the tuberculosis clinic that would serve as a one-stop tuberculosis clinic. It is our sincere expectation that the clinic would fight tuberculosis, which has become a major public health problem in Lesotho with an estimated prevalence of 696 per 100,000 population. The ultimate and end state is to ensure realization of Lesotho National Tuberculosis Program goal, which is to reduce tuberculosis mortality, morbidity, and disease transmission to the level that is no longer constitutes public health problem.
The United States is committed to helping Lesotho on health issues, and this one-stop TB clinic is a testimony to that, said the U.S. Ambassador to Lesotho, His Excellency Mr. Matthew Harrington. He said U.S. has committed over $3 million to HIV response in Lesotho.
This $1.4 million state-of-the-art facility will help the Lesotho Defense Force provide high-quality TB care, treatment and prevention, and it complements our long-standing support to the LDF in the fight against HIV. At this facility, members of the LDF and their families will receive both inpatient and outpatient TB care. Previously, TB services were provided at the Thomas Wellness Center behind me, alongside HIV and other services. That arrangement was not ideal because it put patients not infected with TB at increased risk of infection, and it exposed the clinic staff to risk of infection as well. This new building is designed to relieve overcrowding in the other outpatient clinics and to provide appropriate space solely for TB care.
Dr. Mnyamani, the Minister of Health, said the support of U.S. and other partners to the Ministry of Health is overwhelming, as it helps his ministry to achieve its goals in terms of improving the health of Basotho.
I am pleased to announce that we exceeded our target. We were given a target of 50%. We are meant to have 90% of people in Lesotho knowing their status, 90% of those people on treatment, and 90% with viral suppression. We surpassed that 50% target, we hit 85. Now that triggered $80 million for Lesotho. And we are supported with by PEPFAR and UNAIDS for evidence-based activities with data from the community, to use the data for policy development, data for transparency, data for accountability.
TB is among causes of deaths in Lesotho, and it is imperative for all health stakeholders to fight it. The Minister of Defense, Honorable Sidiso Mokhosi, said according to Global TB Report of 2007, TB remains the major cause of death worldwide.
Whilst on the other hand, according to the Kingdom of Lesotho National Tuberculosis Program Policy Manual, the prevalence of tuberculosis in Lesotho is one of the highest in the world, and that in 2006, Lesotho reported 12,074 tuberculosis cases, of which 11,436 were new cases and only 638 were retreatment.
Both countries have been partners for 50 years now. Selina Leteketa, LTV News, Maseru.